The Omicron variant of COVID-19 is the dominant strain circulating in our state right now, and its subvariant, BA.5, made up more than 1 in 4 of all cases that the state sequenced last month. The big problem? This subvariant is able to avoid the immunity we get from vaccines or from recovering from COVID itself. I spoke with Dr. James Jarvis from Northern Light Health to cover the 3 things you need to know about BA.5.
Number 1, BA.5 is one of the most infectious viruses out there. The World Health Organization is now looking at the subvariant as possibly more infectious than measles, which is top of the list. While the symptoms are similar, the mutation can avoid the protection people have from vaccines or recovering from COVID itself.
Particularly those who are up to date on their vaccines for whatever their recommended boosters are. Those continue to protect you from severe disease, hospitalization, and death. And of course, those are the most important things. So I think it's a word of caution for us that while right now, relatively low numbers out there, still certainly spread of disease in our communities, but it may look like at the end of the summer, the beginning of the school year may be a rough time for us again.
Number 2, expect to need a second booster. Right now, vaccine makers are tweaking their formulas to target the Omicron variant. Dr. Jarvis says there's no official recommendation yet for people ages 18 to 50. He hopes boosters will become less frequent, but expects the federal government will recommend them.
Specifically, the virus that causes COVID-19 is that it mutates at a rate much faster than we've seen with other coronaviruses in a way that makes it so it becomes more and more transmissible. The way these mutations are going, science has to catch up to the mutation, and often that means, that the virus actually is faster than we are at developing things.
Number 3, if you test positive, tell your doctor ASAP. The state has ample supply of Paxlovid and other treatments to prevent you from ending up in the hospital or worse.
And in fact, have a plan for if you test positive, how you're going to get that out, because it is a very time-limited situation for the treatment. But Paxlovid, the oral medication, works very, very well and is incredibly efficient at keeping you from going to the hospital.